Welcome back in, everyone. I'm Tyra Majors. Let's dive right into the deep end. The Washington State Department of Health recently announced Dennis Worsham as the state's new Secretary of Health. He brings decades of experience and deep local ties to the role. Steve is in the ARC Lounge with Secretary Worsham this morning. Steve, I hear he's from Othello.
Yes, he is. You're a local guy.
Yes, I'm a local guy.
Yes, you are.
I grew up in eastern Washington, a little town called Othello.
Fantastic.
And spent most of my adult life here in Seattle, but
Wonderful.
Born and raised in Washington.
We were just talking about, some of the trips over to Wazoo and maybe stopping in
Yes.
Othello, and, some people have gotten some tickets over there before.
Yeah, it's a very popular place.
Yes, it is. Well, it's nice to have you, and congratulations on the tenure. So much. Sort of talk about your background, since a lot of our viewers probably have not heard of you before or seen you in this role before. How did that lead you to what you're doing now as secretary?
Yeah, thank you for that question. I think I've had 32 years here in the governmental public health system in the state of Washington. I went to school over at Eastern Washington University, and my degree was actually in health services administration. And during that time, as I was getting ready to graduate, we came out into the HIV epidemic. Okay. And I was also coming out as a gay man at that time and into a community that was highly affected by this epidemic. And I really wanted to give back in some way. And so moved to Seattle and got a job, my first public health job up in Snohomish County, working in the HIV arena. And although I thought I was just going to come and do HIV work and leave, 32 years later, I've really fallen in love with the mission. I often tell the story about what pulled me in and what keeps me committed. Yeah. During that time frame, as you remember, we didn't have a lot of medications that were effective. Yeah. And we used to start every one of our Monday morning staff meetings in Snohomish County is reading the names of people who died that week. And we would place a flower in the atrium of our building. And every time I placed a flower, it was this call to action of what can we do more to prevent this disease and protect the health of folks. And so I've had this long career. I was up in Snohomish County for 12 years doing HIV, STD prevention work, came down and worked in TB in King County, worked in policy around chronic disease. My first policy out the gate was menu labeling. So if you go to Starbucks, do you see calories?
Yes.
That's my policy.
Thank you for that.
And yeah, it's great, and I just really it's about how do you get information accessible to people to be able to make their best decisions on their health. And I moved into administration after that, became a deputy, went down to the State Department of Health, was the Deputy Secretary of Health there for a period of time, came back to King County in the role of infectious disease director of our division, and COVID hit. Yeah. And really was in the front lines of our first death here in King County in COVID. Our department director retired. I moved into the interim director for the rest of the COVID response, leading King County's work. Went back up to Snohomish County as a department director up there, and now have the great opportunity to serve all of Washington in this role of Secretary of Health.
You've certainly worn many hats over the years.
I have a lot of hats in all different positions, which gives me, I think, a really fair advantage of understanding health and the complications of really having better health for all people in Washington.
Now that we're 5 years removed from the crux of the pandemic, which was certainly an unbelievable time for so many people living not just in Washington State, but around the world, really, where do you take this department now? Where do things go with DOH?
Yeah, the pandemic was tough, right? Yeah. And I think we are still recovering from that as a public health workforce. But it's also understand it really opened up understanding where there are other disparities of health and impacts in communities area. Rural health was a major impact and a challenge for us. And what do we do to better provide access in those particular bodies of work? And what do we really do around chronic disease and leading causes of death? And how do we better work with the whole system, from healthcare to private industry, to our community partners and our public health? And so really leaning into that, I'm going to be doing a 100-day listening tour here in the state of Washington, really trying to figure out how we best strengthen our system and really move us to, propel us to really better health for our entire population.
I know one of the big concerns that I think a lot of our viewers have right now is just the impact of cuts to the federal government and even funding could have on departments like yours or a state like ours. Do you have a good grasp of the full extent of that yet, or when might we know that answer?
Yes, there are things that are unrolling. So we have this convergence that's happening right now around our financing that really supports the programs and the health of our community. We are $100 million from our federal funds are really on the table right now to be cut.
It's a lot of money.
It's a lot of money.
Yeah.
And those are a couple of programs I just want to hit. One of them in particular is around our opioids. You know, we've made great strides, but 3,000 people died of opioid overdose deaths last year alone here in the state of Washington. If you think about that, if you've been to Benaroya, if every seat were filled and standing room only, that's how many people died last year of opioids. That's the funding that's on the table to be cut, and we are slow in being able to meet up with the rest of the state or the country is around turning around that trajectory of those deaths. So that's a real thing that has impacts on people and families here in the state of Washington.
Are there things that you were doing as a department to maybe ask governor for help, legislature for help, or how do you sort of prepare for a loss in funding like that?
Yeah,
what can you do?
Yeah, I think we're going to all have to have a responsibility as a collective impact on that. I think we got to hold our federal government responsible to understand that we pay into the federal system and what dollars are going to come back and really support the well-being and the health of Washington. And so I think that's going to be one strategy that we're playing right now with our delegation and through the legal court system, as we've seen. We cannot pick up those cuts as a state.
It's just too much.
It's just too much.
Yeah.
It's just too much.
Yeah. So the long term, we'll see.
Yeah,
how it goes.
and of course, you know, the Medicaid pieces are top of mind for me as well. And, you know, we've got, I was telling one of our key staff members just recently is that we've got, in the state of Washington, 250,000 people who are going to be at risk of losing health care if this really goes through that was just passed. Of that 250,000 people, you know, the greatest impact is going to be around kids. We have over 800,000 kids in the state of Washington on Medicaid. Some of those counties in the state of Washington here, 90% of kids are Medicaid covered. Wow. So to wipe that out is going to be, we can't pick that up as a system and cover those areas. So we're going to have to do everything we can as a community, as a healthcare system, as a governmental agency to ensure that we do not lose access to healthcare.
Lots to figure out. I know there's lots of issues to cover, and we kind of skimmed the surface this morning, but congratulations on the new role, and thank you for the work that you do.
Yeah, absolutely. Thank you so much for your time.
Nice to chat with you. Yeah, he's a busy guy.
He is, yes, and we welcome Dennis and his years of experience. Thank you so much, Steve.
You bet.